Innovation cannot exist without education, and the president of Healthcare and Education, Patti Urbanski, is here in studio to discuss her role as a longtime educator. Pleasure to have you with us today.
Thank you. Great to be here.
Can you start off by explaining a little bit about your role as president of Healthcare and Education?
So my role in the American Diabetes Association is to recognize those healthcare professionals and individuals involved in diabetes who are not physicians, are not necessarily physician researchers, but really represent registered dietitians, registered nurses, all types of diabetes educators, pharmacists, mental health professionals, all of those who are not physicians but still involved in the care of the individuals who have diabetes.
And roles are very important.
Exactly right.
Okay, your presidential address is titled Lessons Learned, Diabetes Education for One and for All. Can you tell us a little bit about what your address will entail?
So I hope to talk about the importance of diabetes education and how when an individual is diagnosed with diabetes, it's such a complicated condition that everyone deserves the right and the opportunity to have a chance to work with a diabetes educator. And therefore we need to work on expanding where we are providing these education services. And one of my main points is that most people receive their care, their health care, in primary care, and we want to work on moving diabetes education out of diabetes education centers and endocrinology practices and into primary care settings.
Do you feel like there is a lack of education when it comes to diabetes treatment and care with regard to those primary care physicians?
Very often primary care physicians don't realize that there are education services readily available, and we really depend on those providers to sell our services and help people to understand how diabetes education and we educators can really help them learn about this condition and help them to live more successfully with this ongoing chronic disease.
Right. We're focusing on innovation today. How would you say diabetes education has changed over the course of your time as an educator?
Well, just since the pandemic, certainly telehealth and telemedicine visits has become a great addition to the services that we are able to provide and has really opened up access to many people. So learning how to best offer those telemedicine services is certainly something that we need to be continuing to work on, as well as the use of diabetes technology, particularly continuous glucose monitors, and educators can play a main role in helping people use this technology, understand the technology, learn how to interpret what they can learn from that.
You know, you've held a lot of positions over your incredible career. Does anyone stand out to you, or any particular role stand out to you when it comes to having the biggest impact on diabetes?
Well, I have to say serving as president has certainly been very rewarding, and it's been very fun to see the inside operations of the American Diabetes Association and to really appreciate the impact that the ADA is trying to have on the lives of individuals with diabetes, whether that be supporting research, looking for a cure and improvements in treatment, advocacy issues, as well as providing education services to those individuals.
And we should point out you are halfway through your term as president.
I am.
Everything going well, going smoothly?
So far, so good. It's been great.
Well, best of luck in the next 6 months, and we certainly look forward to your presidential address.
Great. Thank you.